Hello, and welcome to Liquid Logic, Patient-Centered Design in Oral Suspensions. We will discuss how thoughtful formulation improves patient experience. My name is Laura Owens, and I'm a Global Strategic Marketing Manager at Roquette. In today's session, we will talk about why patient-centric drug design matters, review the cost of poor adherence, talk about benefits of oral liquid dosage forms, go into the detail on the importance of suspending aids, and lastly, discuss market trends and future horizons. Patient-centric drug development is not just a trend, it's a necessity. When we design with the patient in mind, we improve not only the effectiveness of treatments, but also the experience and engagement of the people taking them. One of the biggest challenges in healthcare is adherence. The World Health Organization, WHO, found that only 50% of patients in developed countries adhere to long-term treatments. To better understand this issue, WHO developed a framework with 5 dimensions that influence adherence. At the top, we have patient-related. These are beliefs, motivation, and sometimes forgetfulness. We also have therapy-related factors, including complexity and side effects. Condition-related factors include severity and comorbidities. Healthcare system-related factors involve provider communication and access. And socioeconomic factors are cost and support systems. Regulatory bodies like the United States Food and Drug Administration now recognize patients as key stakeholders in drug development. This shift encourages us to understand the patient population more deeply. By integrating adherence strategies into drug development, we can create therapies that truly meet patients where they are. Designing with patients in mind leads to better health outcomes. On this slide, we're highlighting the patient groups who benefit most from dose-friendly formulations. First, pediatric patients often struggle with swallowing tablets and are sensitive to taste, which can make medicine difficult to take. Older adults or geriatrics face challenges like dysphagia, which means trouble swallowing, taking multiple medications, also known as polypharmacy, and some have cognitive decline, all of which can interfere with proper medication use. Patients with chronic conditions usually need long-term treatment. They benefit from simple schedules like fixed-dose combinations or extended-release formulations that support better adherence. So why does being patient-centric matter? Patient-related factors compounded with therapy-related factors lead to challenges for the patient. These look like poor palatability and dosing complexity, which then can lead to poor adherence. If these factors aren't addressed, the poor adherence reduces treatment effectiveness, increases complications, raises healthcare costs, and even contributes to drug resistance. That's why patient-friendly drug delivery formats are so important. Let's talk about why oral liquids are such a great option. Some patients that we have mentioned, such as children, older adults, or those with certain medical conditions, have trouble swallowing solid dosage forms. For them, liquids are more suitable and accessible alternative. There are 3 types of liquid oral delivery systems: solutions, suspensions, and emulsions. They let us adjust the dose more easily, which is especially helpful for children or when fine-tuning treatment. Plus, we can add flavors to mask any bitterness, which makes the medicine more pleasant. And in some cases, liquids may also offer a faster onset, which can be beneficial depending on the therapeutic need. And finally, for patients who are managing multiple medications, oral liquids can help reduce pill fatigue, supporting better adherence and outcomes. All of this helps improve how well patients stick to their treatment, and that leads to better results. Let's bring this to life with a few examples of the kinds of patients who benefit from more accessible formulations. First, meet Emma. She's 6 years old and was recently prescribed antibiotics. Like many kids, she struggles with the taste and refuses to take her medicine. A flavored liquid suspension makes it easier for her parents to give her the right dose, and Emma is more than willing to take it. Then there's George. He's 78 and takes multiple medications every day. He has mild dysphagia and sometimes forgets whether he's taken his pills. A once daily liquid formulation that's easier to swallow and simpler to manage helps him stay on track. And finally, we have Sarah. She's 45 and managing a chronic condition that requires long-term medication. She's active and often on the go, so a flexible, easy-to-dose liquid helps her stay consistent without disrupting her routine. These are just a few examples, but they reflect real challenges that many patients face. And they show how thoughtful formulation, especially with the right suspending agents, can make a real difference in adherence and outcomes. Now that we've talked about why oral liquids are so important for patients, let's focus on oral suspensions and take a closer look at what actually goes into them. This slide gives a high-level overview of the different components that make up a pharmaceutical suspension. Of course, we'll start with the active drug, but that's just one part of the picture. To make the medicine more effective, stable, and pleasant to take, we also need a range of excipients. These are functional ingredients that support the formulation. You'll see categories like suspending agents, which help keep particles evenly distributed. We'll go into more detail on these later. Dispersants and protective colloids support stability. Sweeteners, flavors, and colors improve taste and appearance. And preservatives, buffers, and sequestrants, which help maintain safety and shelf life. All of these work together to ensure the medicine is not only effective, but also something the patient can and will take. Now that we've seen what goes into liquid medicine, let's focus on one of the most important components, suspension aids. A pharmaceutical suspension is a liquid dosage form where solid particles, like the active drug, are dispersed in a liquid. But without the right suspension aid, those particles can settle at the bottom, leaving inconsistent dosing. Suspension aids help keep everything evenly distributed, so each dose delivers the right amount of medicine. That's especially important for patients who rely on accurate, consistent dosing, like children or those with chronic conditions. They also improve the stability of the formulation, which helps extend shelf life and maintain effectiveness over time. And from a patient perspective, they play a big role in safety and compliance. If a suspension separates or becomes gritty, patients are less likely to take it correctly, or at all. One well-known example of a suspension aid is colloidal Avicel, provided here at Roquette. In the next slide, we'll show a visual demonstration that highlights just how important suspending aids are in liquid medicines. We are using a common example, an over-the-counter pediatric medication. These are often suspensions where the active drug is dispersed in a liquid, but sometimes they're not. Without a suspending agent, the particles settle quickly. That means the bottle needs to be shaken before every use. But will a parent remember to do that? And if they do, will they shake it enough to fully redisperse the drug? If not, the child might get too little medicine in one dose and too much in another. That's a serious risk when it comes to treatment effectiveness and safety. In this next slide, we'll show how important a suspending aid is for consistent dosing every time, without shaking or guesswork required. At the start of this video, we have two medicines, On the left-hand side, we have an over-the-counter medicine without a suspending agent. This is the type that you have to shake before every use. On the right-hand side, we have another over-the-counter medicine, and this one has a suspending agent. This kind of medicine suspends the drug within the liquid. You can see over time how the left-hand side medication is starting to separate, with some of the ingredients floating to the top. These ingredients could include the active, which is the medicine. On the right-hand side, with the suspending agent, the liquid remains the same over time, stable and well incorporated. Now that we've seen how suspending agents improve the patient experience, let's zoom out and look at the bigger picture. What's happening in the market? The pharmaceutical liquid suspensions market is growing steadily, with a projected value of over $5 billion by 2033, driven by a 6.5% compounded annual growth rate. This growth reflects a rising demand for patient-focused formulations, especially among populations like older adults. In fact, 27 to 29% of geriatric patients report difficulty swallowing. That's not just a minor inconvenience. It can lead to serious issues like aspiration pneumonia, malnutrition, and poor adherence. At the same time, the global population is aging. By 2050, 22% of the world's population will be over 60. That's a huge shift, and it's driving the need for more accessible, easier to use dosage forms. And it's not just over older adults. A 2021 survey of over 1,100 children across Europe found that liquid dosage forms are the most preferred, especially for kids under 12. For both ends of the age spectrum, flexibility and ease of use are key. This is where oral liquids support personalized medicine, helping patients take their medications correctly and ultimately lead to better outcomes. As we wrap up, here are a few key points to remember. First, oral liquids are essential for many patients, especially those who struggle with swallowing or need flexible dosing. They're not just an alternative, they're often the best option. Second, suspension aids are critical. They ensure dose accuracy, improve stability, and make the medicine easier and safer to take. Without them, the best active ingredient can fall short. Third, excipient selection matters. These ingredients aren't just filler. They directly impact how well a medicine works and how likely a patient is to take it consistently. And finally, patient-centric design leads to better outcomes. When we consider the real needs of patients, whether it's taste, texture, or ease of use, we create formulations that support adherence and improve lives. Lastly, we will highlight two key suspending agents here at Roquette in our colloidal Avicel line. We have Avicel RC591 and Avicel CL611. I would like to thank you for attending today. You can connect with us on our website, through social media, or your account manager. Be sure to stay tuned for our next webinar on troubleshooting liquid suspensions. Our suspensions expert, Yeli Zhang, will take you through some of the most challenging formulations that you face and how to overcome them.